Welcome back, guys. So in this section, we are in the continuation of the NVBDCP. In the last one, we have talked about the malaria in detail, right? And here in this section, we shall be talking about the filariasis, right? So if we talk about the filariasis, guys, it is also known as elephantiasis. Yes, it is also known as elephantiasis, right? If you talk about the causative organism or the causative agent over here, that will be the Wuchereria bancrofti, right? You must have heard about that in the biochemistry section. Wuchereria bancrofti. Okay, so microfilaria larva, right, of this particular agent, that is the Wuchereria bancrofti, they will be growing inside the lymphatics of the person, right? They are growing inside, they grows inside the lymphatics, right? They grows inside the lymphatics of human, right? And it will be coming, the larva will be coming in blood. Larva comes in blood during the night time usually. Larva comes in blood during the night time, and that is in between around 8:30 p.m. to the 12 a.m. right? So larva will be coming into the blood at that point of time, right? For mass diagnosis for the filariasis, for mass diagnosis, right, we are collecting the blood of the person, right? So what we are doing is that we are collecting the 20 ml of blood, right? 20 ml of blood will be collected in between the 20 ml of blood collected in between the night time, collected between between the 8:30 to the 12 a.m. 8:30 p.m. to the 12 a.m. right, from the villagers, right? So that we are asking, we are actually knowing the filariasis incidence over there in that particular area, right? So for the individual diagnosis, guys, what we shall be doing over here, right? Now for the individuals, what shall we be doing? For the individuals, what we shall be doing for them, right? So what we were doing, basically we are going for the DEC stimulation test. We are going for the DEC stimulation test, right? Now you might be asking, what is DEC? DEC is nothing but the diethyl carbamazepine, right? DET is the diethyl carbamazepine, right? Okay, so drug of choice over here will be the DEC, guys. Drug of choice over here will be the DEC, and we are giving that 6 mg per kg per day for 12 days for the filariasis. Okay, so please do remember, this is the MCQ, guys. Drug of choice for the filariasis is the 6 mg per kg per day for 12 days. We are giving the diethyl carbamazepine, that is the DEC, right? Okay. For the mass chemoprophylaxis, guys, for mass chemoprophylaxis, what we shall be doing, right? We want to do the prevention, we want to do the prophylaxis. For what? For mass chemoprophylaxis, what you should be giving, right? So if we talk about any kind of village, let's say there are high incidence, high prevalence of the filariasis over there, high prevalence of Wuchereria bancrofti, right? And we know that it is prevailing in the lymphatics, so it shall be causing the elephantiasis to the persons and all, right? Mainly the lower limbs. Okay, so over here what we shall be doing over here is that it will be given to villagers. It will be given to villagers or that endemic area, right? Given to villagers, right, which are suffering from filariasis, Okay, what could be the drug of choice over here? Drug of choice for those cases will be the DEC. Along with that, we shall be giving the deworming tablet, that is the albendazole tablet, right? Albendazole tablet, right? Now, if you talk about this larva of the Wuchereria bancrofti, right, it will be showing the cyclodevelopmental life cycle, right? It will be showing the cyclodevelopmental larva will be showing the cyclodevelopmental cycle. Cyclodevelopmental cycle means cyclodevelopmental life cycle. Okay, it means that basically the parasite will be growing inside the host, okay, but they do not multiply. So the parasite grows inside the host, parasite will be growing inside the host but do not multiply, okay, but do not multiply. So that is for the cyclodevelopmental cycle. So it will be growing inside the parasite, but parasite will be growing inside the human, but they do not multiply. That is the cyclodevelopmental life cycle it will be following, basically, right? Now we shall be coming over to the Japanese encephalitis, right? Now let's talk about the Japanese encephalitis, right? JE. JE is for what? JE is for the Japanese encephalitis. This is the Japanese encephalitis, right? What is the causative agent, guys? Anyone? The causative agent is arbovirus. Yes, that is the causative organism or causative agent or the etiological agent. That is the arbovirus. Very, very important. Please do remember that, right? Then we shall be talking about the transmission, right? It is actually usually transmitted by the Culex mosquito. Please do remember which mosquito I am talking about. It's transmitted by the Culex mosquito, right? Japanese encephalitis is transmitted by the Culex mosquito, right? Here the pig is the main amplifying host. Please do remember, pig will be the main amplifying host and human is the accidental host. Very, very important. Human is the accidental dead end host. Human is the accidental dead end host. Okay. So please do remember, human is the accidental dead end host over here. These two lines are very, very important. Pig is the main amplifying host and the human is the accidental dead end host, right? Now guys, it will be breeding in the dirty water or the clean water. Aedes, it breeds in the clean water, but Culex mosquito I told you in the entomology as well. For detail we shall be going to that chapter as well. So Culex mosquito, guys, it likes to breed in the dirty water. So it will be breeding in dirty water, right? In dirty water. I told you for the malaria that we shall be using the residual spray. Shall we be using the residual spray over here in this case? No, we shall not be using the residual spray. There is no use of the indoor residual spray over here, right? So there is no use of indoor residual spray. There is no use of indoor residual spray. Okay. So these are some of the important points over here. What could be the signs and symptoms? However, you have studied about them in the medicine also. So what about the signs and symptoms of the Japanese encephalitis? So signs and symptoms are very simple over here. The patient might be having the frontal region headache. The patient might be having the very vague symptom like nausea can be there, vomiting can be there. The patient might be having the fever. The patient might be having the rigidity in the neck region. So neck rigidity might be seen. In some patient there could be the abnormal movements as well. Right, in some patient there could be the abnormal movements, right? There could be the myalgia, right? There could be the generalized weakness and all of these symptoms, right? Generalized weakness can be there, right? So these are some of the symptoms, guys, which we should remember for the Japanese encephalitis, right? Japanese encephalitis. What could be the treatment? What could be the treatment modality over here? Treatment, how you can treat this patient? So you will be giving the symptomatic management will be given paracetamol for the fever and you will be giving the IV fluid resuscitation to the patient, right? Rather, I will be writing the symptomatic management you will be doing, right? Symptomatic management, right? Give the IV fluids for the dehydration part. IV fluids for the resuscitation, IV fluids for the dehydration part, okay? So this is the thing for the treatment purpose, right? For the management purpose. One more thing I would like to mention over here, guys. What about the vaccine you shall be giving, right? So please do remember, very, very important, we are giving the SA 14-14-2 vaccine, which I have covered in the immunization section as well. You shall refer to that chapter as well, which is the live vaccine. This is the live vaccine, right? And it shall be given up to 15 years. I have covered that in the national immunization schedule as well, right? And it shall be given in the endemic areas, mainly the Gorakhpur region of the UP is the endemic area for the Japanese encephalitis. So it shall be given in that area to the adults as well. Usually it is given in the children, but to the adults as well for the prophylaxis purpose, we shall be giving it over there as well, right? So that was about the Japanese encephalitis, right? Now we shall be talking about the dengue, guys. We shall be talking about the dengue fever. Very, very, very important dengue, right? And usually we are seeing that in the communicable disease and in the communicable disease mainly I have talked about the dengue as well, that over there in short I have talked about that usually it is actually coming in the July period, right? So July to the from the July to the February period, this is the period where the dengue is actually coming. What is the causative agent over here? Aedes mosquito, right? So it is also known as the break-borne fever, guys. It is also known as the break-borne fever. Break-borne fever. It is also known as a break-borne fever. Which vaccine we shall be giving over here? We are giving the Dengue vaccine, right? This is the dengue vaccine over here, right? Here in this vaccine there are 4 strains. So there are 4 strains which are present over there, right? Now if we talk about the signs and the symptoms of the dengue virus or the dengue fever, right? Usually fever can be there, myalgia can be there, generalized weakness can be there, right? All of these symptoms are there, but let's talk about them, right? Here we are having the phases, guys. Here we are having the phases, right? It shall also be causing the dengue hemorrhagic fever. Dengue hemorrhagic fever, because here the platelets will be decreasing very rapidly, right? So dengue hemorrhagic fever we shall be seeing over here, and we are having the phases. In the phase 1, right, we shall be talking about the signs and symptoms, right? Like the frontal headache can be there, the patient might be having the bone pain, the patient might be having the nausea, vomiting, the patient might be having the fever, right? The patient might be having the positive tourniquet test. This is very, very important, guys. Positive tourniquet test, right? Very, very, very important positive tourniquet test, and it signifies that patient might be having the thrombocytopenia, right? So it is a very important sign for the thrombocytopenia. So positive tourniquet test, it might be signifying that the patient is having the thrombocytopenia. Okay, so please do remember that. The next one which we shall talk about over here, that is the phase 2. So phase 1 we have talked about phase 1, then we shall be talking about the phase 2. We shall be talking about the phase 2. In the phase 2, guys, what is happening? Signs and symptoms we are talking about over here, very simple. In the phase 2, all the symptoms of phase 1 might be present. All the symptoms of phase 1 might be present. With that, we shall be having the spontaneous bleeding from the nose or the gums or the anus, right? Spontaneous bleeding, because thrombocytopenia is prevailing now. Spontaneous bleeding from different parts of the body, So why is it so? Because thrombocytopenia, it will be decreasing, and if once the platelet will be coming down below lesser than 50,000, what is the normal levels of platelets, guys? Yes, that is 150,000 to 450,000. So if it will be coming, it will be coming gradually and rapidly. In some patient it is coming down gradually, in some patient it is coming down rapidly, and once it is crossing the limit of threshold of 20,000, also lesser than 20,000, so we might be needing the transfusion of the platelets factor over there, or we might be needing the transfusion of the platelets, we might be needing the transfusion over there, or in that case the bleeding might be there from the patient side as well, severe itching can be there in the patient side as well. Okay, so that could be the signs. Third symptom which we shall talk about over here, third phase which we shall talk about over here, phase 3, right? That would be the phase 1 and phase 2 features might be present. Phase 2 features might be present over there. With that, okay, we shall be talking about the low pulse pressure. We shall be talking about the low pulse pressure, that is lesser than 20 millimeter of mercury. Low pulse pressure can be seen, right? Then at last we shall be talking about the phase 4 as well, right? Phase 4 as well. And if you talk about the phase 4, here the phase 3 symptoms will be present. With that, end organ failure might be there in some patient, end organ failure. So it is a very dangerous phase, guys. End organ failure might be there. Let's say the kidney failure might be seen for an example, right? The patient might be in the shock, right, where the systolic blood pressure might be lesser than 90 millimeter of mercury, and in that case, if that is happening, okay, then we are calling that as dengue shock syndrome. If that is happening, then we are calling that as dengue shock syndrome. So we are seeing that dengue is the break-bone fever, because bone pain might be there in the phase 1, phase 2, phase 3, phase 4 are also there, phase 4 phases are there. In the phase 4, there could be the end organ failure, there could be the shock. If the shock is persisting, then we are calling that as dengue shock syndrome. And in some cases, the hemorrhage is happening as well due to the thrombocytopenia component. So in that case, we are talking about the dengue hemorrhagic fever as well, right? So that is the thing over here. So phase 3, phase 4, if I'm talking about, guys, phase 3 plus phase 4, right, that will be considered as the dengue shock syndrome. Okay, so please do remember. What are the investigations which you shall be asking for? Right? So you shall be asking for the ESR, you shall be asking for the platelet count, right? So daily platelet count shall be sent for this person, and itching might be there in these persons, so you need to identify, you need to monitor these things, right? So you need to monitor these signs over there. Okay, what about the treatment, right? here what about the treatment? So treatment will be the symptomatic management completely, guys. Here we don't have the treatment as such. If the fever is there, give the paracetamol. If the dehydration component is there, so give the IV fluids. Proper IV fluid should be given for the rehydration part. So for the dehydration, we should be giving the IV fluids over here, right? If the platelets are decreasing, so platelet infusion might be needed. Platelet infusion if needed, right? Otherwise, if the platelet counts are normal, right, in the CBC or in the platelet count, so we are asking for the platelet count over here. Daily platelet count should be sent for the patient because we want to check for the platelet count in this person regularly, because platelet counts might be decreasing, right? Okay, guys, now we shall be talking about the chikungunya, right? Now we shall be talking about the chikungunya. Okay, after the dengue we shall be talking about the chikungunya. Chikungunya, guys, it is also called as the disabling fever. Disabling fever. Why it is disabling fever? Because person is almost disabled. Why is it so? Because severe joint pain can be there for a very long period of time, right? So that is the thing over here. So it is also called as the disabling fever. And the signs and symptoms, what could be the signs and symptoms are as far as what could be the signs and symptoms as far as chikungunya is concerned over here? So there could be the fever. Along with that, there could be the joints pain, that is called as the arthralgia. That is called as the arthralgia, right? Along with that, the person might be having the joints pain which will be prolonged. Joints pain will be prolonged. So arthralgia, that is the prolonged, that is the joint pain, but here the prolonged joint pain might be there. Prolonged joint pain might be there. They might be persisting. They persist for about 10 to 15 years. They might persist. I am saying they might persist for about 10 to 15 years in some cases. Otherwise, in some cases it might persist from months to years, right? So that is the thing over here. Treatment for the, okay, so if we talk about the treatment over here, symptomatic management, otherwise you shall be giving the PCM for the fever component over here, right? And rest symptomatic management will be done. Rest symptomatic management shall be, right? So that is about the 4 diseases over here. I have talked about the filariasis, I have talked about the Japanese encephalitis, we have talked about the dengue and the chikungunya over here, right? These are the main components of the NVBDCP program, right? So that's it about this one, and I hope you will be able to solve as many MCQs as you can from this particular session. Please go through it, revise it, and try to correlate it with other chapters also. For example, this one you should be correlating it with the National Immunization Schedule and the Entomology chapter as well, right? So all the best for your exams, and as always, keep reading, and you will be getting your better results. Thank you.